None of this is regulated. It's all it's like a free-for-all right now. And you really do have to look because like billions, millions, who knows? You don't know. I mean, I'm not making it. I'm not in the lab. I don't know what the hell they're putting in that. It could be crushed up bugs. Who knows? Maybe crushed up bugs is good. We don't know. We don't know.
Yeah, maybe, depending on the bug.
Exactly. Could be filled with protein.
This is Fat Science, a podcast dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better. This podcast is for informational purposes only and is not intended to replace professional medical advice.
I'm Dr. Emily Cooper. I've been treating patients with metabolic issues for over 25 years. I'm on a mission to raise awareness about metabolic dysfunction and why diets don't work.
Hi, I'm Andrea Taylor. I've been fat, very fat, chubby, morbidly obese, and done almost every diet ever invented. They all worked until they didn't. I've known Dr. Cooper forever, but when I became her patient and we learned metabolism was the real problem, wow, everything changed, and I've never been healthier.
And I'm Mark Wright. It's time for Fat Science.
Wait, does this podcast make me look fat?
Welcome to Fat Science. I'm Mark Wright, along with Andrea Taylor and Dr. Emily Cooper. Great to see you two.
Hello.
All right, I'm trying to still figure out what we're going to call this episode, but it has to do with the idea that digestive aids and tweaks to the digestive system are somehow the key to overall health and weight loss. And we're going to clear up a lot of misconceptions today.
Or maybe they're not the key.
Or maybe they're not the key. We're also talking about things like acid reducers and digestive enzymes. So, Dr. Cooper, if you would set the table for us, I wasn't even aware that you could buy digestive enzymes at the store, and I don't even know what they would be used for. So why don't you tell us, I'm struggling. You can tell I'm struggling. So I'm going to hand it off to you.
All right.
And let you set the stage.
Well, our body produces its own enzymes that help us digest different food sources. And those enzymes come from our mouth and also our pancreas. And they help us digest carbohydrates and starches, proteins, fats. And so they're produced in response to the food. Normally, a person can manufacture their own digestive enzymes in response to food at the right amounts and the right quantities. And sometimes there is some disease of the pancreas which inhibits the ability to produce them. And there are prescription strength replacement enzymes that can be prescribed to people that are in that situation. But there's a ton of these over-the-counter digestive enzymes, and they make their way into a lot of other supplements too. And so it has become one area that I'm always looking at the ingredients of all the supplements that patients are taking just to make sure there are not digestive enzymes in them. And the reason is that when you take digestive enzymes over the counter, and most people take it just like as a way to settle your stomach, they're marketed as something that helps your digestion. But when you take those and before you eat and then you eat, it can really alter the way the food is broken down and the signals that food delivers to your system. And so as a result, your insulin response from the pancreas can actually end up becoming too elevated and too quickly elevated. And when that happens, these spikes in insulin that can occur after eating cause a reaction that's called reactive hypoglycemia, a low blood sugar reaction afterwards, because as we know, insulin helps carry the glucose into the tissues to use for fuel, and it should be matched to whatever the glucose is. But taking the digestive enzymes does increase the insulin in most people that we have tested. Now, it could be that people without any metabolic disturbances or any problems, taking them once in a while, I'm sure is fine. But when people repeatedly take these, especially if they're in that boat of metabolic dysfunction, there's that risk that they're altering the insulin level in a bad way and causing it to accentuate too quickly, which can cause the blood sugar to drop, which then makes your body think instead of eating food that you actually took food away when you ate because of this abnormal reaction.
That's really interesting. And I guess we should let people know that, as you said, the body produces these enzymes. Like your saliva has amylase, which is an enzyme that breaks starches down into sugars. And you've told us repeatedly that that is such an important process because those starches get broken down into glucose that goes into the bloodstream that fuels just about everything that our body does, right?
It's true. And actually, some patients with metabolic dysfunction, their body produces too much amylase. And that is part of their metabolic problem. And so then you'll find people like that then are also supplementing with digestive enzymes, which contain amylase or something called pancreatin, which is also contains amylase, and alpha glucosidase. These are all enzymes that our body makes that are supposed to be matched to our food intake in order to regulate our metabolism and our digestion. But in some people, there are already pre-existing imbalances, and then adding these digestive enzymes can make it worse. It really usually is the amylase that's the culprit with the digestive enzymes. So the other elements like lipase and proteases, those normally don't aggravate the metabolic system as much. It's usually the amylase and something called pancreatin that's in these digestive enzyme products that could throw things off balance. So it's one of those things that you can't really test probably very easily to see if in your body it does that, but maybe we don't need to take them in general, unless there's a really good reason to. And so again, I think having a medical evaluation to see, is this something you really need? Because they are being promoted almost like candy to everyone that complains about digestive issues. But the bigger concern would be, well, why do you have the digestive issues in the first place? And is there something else that's the root cause of that?
Andrea, at the supermarket where you go, I mean, do you see a lot of these?
My fancy one, my fancy one that has a lot of digestive aids and weight loss products.
So again, the problem is that if you're getting digestive enzymes, they almost always have amylase because it's like one of the biggest ones in there, the most concentrated. And if you're getting often other products that are marketed for digestion, you'll see there's amylase in those too. And so I try to have people avoid that particular digestive enzyme just because of the risk that it could throw the insulin levels off or accentuate an already pre-existing problem.
And what about the billions and billions and billions of active, what am I taking? The
Like
billions of,
lactobacillus and all
yeah,
those other.
all those things that I ingest.
Well, that's probiotics.
Yeah. Oh,
And
sorry, the
Now, what is the
probiotics.
difference, Dr. Cooper, between a probiotic?
And there's a prebiotic. I'm always confused. I have to ask. There's some very helpful people usually in the aisle. I'm like, wait, probiotic, prebiotic. I think I want the probiotic. I don't want the millions. I want billions.
And what is the difference, Dr. Cooper, between a probiotic and a
And a
digestive
pre.
enzyme?
and a digestive enzyme, there's a big difference because the digestive enzymes, again, help you like break down the food products and get that digestive process going. And our body, again, makes the proper enzymes in order to respond to the food intake and to deliver those to our system so that we can break it down. And by breaking down the food products, it does help as it goes through our GI tract to encourage development of healthy flora. But the probiotics are marketed as improving our microbiome, our gut flora.
So that's just all the bacteria that are in the gut, right?
Yes.
That are good.
Well, some are good and some are not as good. Yeah, I mean, it depends. And we had an episode about the microbiome in the past that people could refer to that goes into some detail. But the microbiome is largely dependent on our diet, basically. So if our diet is rich in whole foods with a lot of produce and whole grains and beans and legumes and plant products and things like that, normally it's going to be healthier, our microbiome, normally. And especially if we also include foods that have live cultures like fermented foods, sauerkraut, pickles, miso, kimchi, yogurt, kefir, things like that. And so through the diet, if we have a varied diet, we probably, and our stomach feels fine and our digestive system feels fine, we probably don't need to take a probiotic. But But if there are issues that you're experiencing, then some people turn to probiotics as a potential solution. And probiotics are funny because if you look at the label of probiotics, you'll often find digestive enzymes in them added to them, and it doesn't really tell you they're in there. So I always look to see if people are on probiotics or whatever, again, because I'm screening to make sure we don't have the amylase in there.
I'm going to look at mine after this episode is over.
I think it's also important, Dr. Cooper, you suggested that we take a look at elimination diets. And it just seems like with so many people cutting gluten out of their diet, you see gluten-free on all kinds of products, even ones that don't have
Yeah.
grains.
Strawberries.
Glutens are, various proteins that you find in whole grains. And unless you're intolerant to gluten, it's actually really good. It's protein from grains, right? But we somehow think that cutting out gluten or cutting out starches or nuts and stuff like that is somehow good for our digestion and our overall health. I'd love it if you could address the idea of these elimination diets and why universally they may not be a good thing to do.
It all boils down, whether we're talking about the digestive enzymes or the probiotics or other products that people take for helping their GI discomfort, it boils down to find out what's causing the GI discomfort in the first place. Get a workup, go find out, try to see a GI doc or your primary care doc and find out what could be the root cause of it. Because rather than just adding a bunch of different supplements that you're not sure are actually attacking it, or especially before you eliminate foods, because again, going back to the foods and the nutrition, we need a strong nutrition base if we want a healthy metabolism. And the more we eliminate food groups, then we're taking away that potential. We're taking the potential of that food group out of our diet. And so most people then are not thinking clearly of how they're replacing those nutrients that they're removing. Often they're not actually replacing those nutrients, and their diet changes in a way that makes it less healthy. Some studies show the more gluten we eat, the lower the obesity and diabetes risk, not the opposite. Some people don't digest certain things well. And then again, it's well, why? Why are we not digesting that well? A lot of things depend on enzymes and that microbiome to help with our digestive process. And so we want to think about what could we do with our diet maybe so that we can maybe introduce foods in a way that helps us digest them better. With metabolic dysfunction, there can be problems with gut motility. And so that's something to think about because patients who have diabetes may have what's called gastroparesis, which is this slowing of the upper stomach emptying so much that food really doesn't move through the GI tract correctly. And that can lead to problems with altering the sensation of, digestion. And so that could be a special case, but the solution might be something different than eliminating foods for that. And other times there are some metabolic problems that cause different hormones. There's a hormone called cholecystokinin. And when that one goes up, it actually can cause your stomach to kind of fill up a bit with fluid and stop your stomach from moving. And so that could be an issue. There can be gallbladder issues too. There can be people who had gallbladder removed that have issues with something called bile acid malabsorption syndrome. There's just all kinds of things. There's inflammatory bowel disease. So I think people need to have a full evaluation medically, find out really what is going on before just starting to eliminate entire food groups from the diet. And then when it comes to gluten, of course, people with celiac disease need to eliminate gluten entirely because celiac disease is a problem where if you do not eliminate gluten, you really can't absorb nutrients well at all, any nutrients well. And so it's an autoimmune condition that requires a total elimination of gluten. But if it's not celiac disease, and people refer to these as intolerances and things like that, it's probably better to try to figure out how to improve maybe your gut microbiome by keeping your diet healthy, look and see if there's any medications that are causing GI problems. Is there an underlying GI pathology causing it before eliminating the food groups? Just because once you do that, you're eliminating a whole group of foods that could be providing good nutrition.
So we all have stomach acid, so that hydrochloric acid does a whole bunch of different things when we eat food, and it kind of unfolds the proteins. It kind of partially breaks up some of the carbohydrates. But too much of that hydrochloric acid is something that a lot of us deal with. And Dr. Cooper, I think I've mentioned this to you before, but I've been taking omeprazole, the brand name I think is Prilosec, for probably 20 years because I've just had terrible acid reflux since I was a kid. And I think there are a lot of people who take these different drugs. But you say long-term use of these comes with sort of a warning, right? So what are some of the things that can happen? And you called them PPIs. What does that mean?
Those are called proton pump inhibitors. So they are acid reducers. But the problem with those, and a lot of people like you, Mark, are dependent on those. And once again, go back to what's the original pathology that's causing it? Is it a hiatal hernia where the stomach is like swishing up the acid all the time and that's causing this reflux issue? And is that something that needs to be treated more aggressively? There's other techniques for treating that. Or is it something like gastritis or esophagitis, where there's inflammation in the esophagus or the stomach? And sometimes it's actually misdiagnosed too. Sometimes it's actually a lack of stomach acid that's causing the problem. And so one of the ways to check that is to actually stick a probe down when they do things like endoscopy and measure the pH and things like that, where they can test. Of course, they look also for that bacteria, H. pylori, that is a culprit in causing stomach ulcers and stuff like that. But the reflux is dangerous because it can cause inflammation of the lower esophagus, which can lead to something called Barrett's esophagus, which is precancerous, and it can lead to esophageal cancer. And so you have to keep the inflammation down and have regular checks to make sure the inflammation is staying down. In the meantime, people tend to just take these meds to calm it down, and they tend to work a lot of the time. But the problem is these acid reducers, they affect our absorption of a lot of different nutrients. So they impair the absorption of a lot of minerals and some vitamins. And so that tends to be not beneficial, and it can lead to bone density problems long term. And so the other big thing that they're finding about long-term use of this group of medications is that they also have detrimental impact on our microbiome. Again, this is where the big concern is, because this microbiome has been linked now to obesity risk. If it's not healthy, it's linked to obesity and diabetes risk, cardiovascular risk. And we're finding that microbiome communicates with our brain, actually, and alters our metabolism and all of our cardiometabolic risks. The problem with these proton pump inhibitors, these acid reducers, is that they do cause detrimental impact on our microbiome. And so now we're back to, okay, what about these probiotics then? And the studies did show that people on long-term proton pump inhibitors did benefit from probiotic supplementation to help prevent that alteration of the microbiome.
So Mark needs billions and billions.
That's really interesting. And when I mentioned to you that I had been on these acid reducers for 2 decades, I think you mentioned, hey, maybe you should have that checked. And they actually did scope my esophagus, and they found that there were no abnormal cells, which is surprising because of how long I've had this elevated acid level in my esophagus. But just keeping an eye on it, making sure, they just said, yeah, everything looks good, but we'll keep an eye on it.
And you said it started when you were a kid, didn't you?
Yeah, actually, my dentist, when I was a teenager, said, do you have heartburn? And I said, yeah, I do. And he said, well, I can tell because your molars, you have some pitting on your molars. And what was also interesting is that when I was, probably in my 30s, my asthma doctor asked if I had acid problems, which I thought was a weird question from an asthma doctor. And I said, well, yeah, funny you should say that. Multiple times a day I clutch my chest because it's killing me from the acid. And he goes, well, that's pretty common among asthmatics, and it can be one of the triggering factors for asthma. And so I actually was put on omeprazole by my asthma doc in the beginning, which was really interesting and intuitive that doctor was asked that question, because I found that really interesting.
Yeah. And I think maybe that is a good little thing for to explore, is there any other solution for this? And what is the mechanism? Is there maybe a muscular issue at that lower esophagus that makes it not so tight or not as tight as it should be or something? So that would be a good future question.
I had huge problems with the acid reflux, and when they went in to do my gastric sleeve, they found that I had we knew that I had a hiatal hernia, but when they went in to do the gastric sleeve, they didn't know how big it was because they couldn't, like, without doing a scope and going in surgically, they could never have seen how big it was because without going in for surgical procedure, you wouldn't know. And he sewed it up, and I haven't been on any medication for that since. So that was pretty amazing. That was a nice little benefit to not take that pill every day.
Wow, that's really cool.
Yeah.
Dr. Cooper, of all these PPIs, I mean, there are so many of them on the market. Are they all basically the same in terms of the physiology, how they, reduce acid in the stomach?
Yeah, I mean, I think they're all similar and they all have similar potential side effects. They can also interact with certain medications too and prevent absorption of certain medications. So it's good to just review if you're on them long term, every time you have another medicine added, kind of review and see if there's any concern there. But I think getting back to what could people do if they are dependent on these things and they have had a good workup and this is what's really recommended long term, I would definitely try to get an age group of over 50, maybe a bone density scan if you've been on them long term, just to make sure, and just check blood levels of other nutrients that they might affect and make sure that those are not low, make sure there's no medication interactions, and just keep asking if there's another alternative. And whether, if they don't seem like they're helping, that's definitely a reason not to continue to take them. To talk to your doctor about not staying on them.
But isn't that interesting, Dr. Cooper? I feel like we're just beginning to understand the value of the microbiome in
Yes.
terms of overall health. Leaky gut syndrome is another thing that's talked about. There's a very, very thin, almost one cell layer in our gut, and multiple times a day we're taking impurities and dirt and stuff from the outside world and putting them inside our body. And our body needs to have that ability to kill the bad stuff and keep the good stuff. And I mean, what have you learned about the microbiome? And do you feel like that's like the next frontier of understanding health?
I think it's such an important area. It really, really is. And I think that instead of people like jumping to a lot of outside things to correct it, I think we're not taking enough advantage of just the natural, like our diet, because the diet makes so much difference in that microbiome. And so I think the more we can do with that, the better. But if you are a person that's in a category where you do have something like, this acid reflux, you have to be on omeprazole or one of those other ones, or even with Crohn's disease and things like inflammatory bowel, they're showing some benefit potentially to being on a probiotic, taking an over-the-counter probiotic. That might be still beneficial. But then it comes to, well, how do you know which one to take? Because as Andrea always says, there's so much different marketing around these
Right.
things.
You got the billions or the millions or the refrigerated versus the non-refrigerated, the dead versus the alive versus it's so confusing.
Yeah, and what that refers to, those numbers refer to these colony forming units. And so, there are some organizations that are trying to get regulation, which I think is great because right now they're not FDA regulated mostly. Some of them are because they're manufactured by companies that make prescription strength level. So when I prescribe them, I usually prescribe the ones that are made by a company that does the prescription strength because their company is FDA supervised, scrutinized. But some of the guidelines that they're trying to implement and that they do recommend is that you make sure that whatever they say, however many colony forming units there are, that it's guaranteeing that those will be alive. They have to be live colonies. They can't be, if they're dead, they don't do any good.
Right.
But they have to be live through the expiration date on the packaging. And so they have to be able to guarantee that they will be alive through that expiration date. And that companies don't guarantee that. And so if
And it
that
sounds gross, but it's not gross.
but that's where a lot of the refrigerated ones come in because they can stay live longer, most of them can if they're refrigerated versus dried, just dehydrated and dried and non-refrigerated. But the other thing is to make sure that it is what they say it is. Again, we've talked about this before, the GMP certification. It's very important with probiotics because if it's not, you don't really know if it contains those organisms it says or if anything on the packaging is correct. So GMP certification, a guarantee that these colonies will be alive through the expiration date. Then they're supposed to also provide the information that assures that there's no pathologic bacteria in there that could trigger infections because it can. You're introducing a bacteria. And so that's supposed to also be included ideally. And then the last thing would be antibiotic resistance, that they're showing that there's no organisms that are resistant to antibiotics. Because if, say, something caused a problem and you have to be able to wipe it out or rebalance your bacteria, you don't want to have antibiotic resistant bacteria introduced into your system. So those are some guidelines that have been suggested, and there's some organizations that do certify now. And so I would look it up and see what certifications are on the packaging. And if there aren't any, I think that's a bad sign if there's not this third-party testing. And if it's a prescription company that does it by prescription that's FDA regulated, it's probably safer. But there's certain organisms that are thought to be better, lactobacillus, bifidus. Those are the ones that are the healthier organisms. And so, but I think it's hard to assess if you take these, is it working? Because some people, like say Mark,
know.
who might be taking it for a preventive, may not have GI side effects right now, GI problems that you can gauge. So you just start taking something you don't know. Is it working? Is it changing the microbiome? So I'm really happy that we can now test a blood marker, which is pretty amazing. And the reason we can test this blood marker is because it's now associated with increased cardiovascular risk if it's elevated. But the marker tells us it's produced by unhealthy flora, this marker. So unhealthy flora in our gut will lead to an elevated level of this marker, which is called TMAO. And that marker, if it's elevated, would be a red flag that your microbiome is not as healthy as it should be. So I'm just thrilled that we can get that marker now in the blood, because at least now we have some way to identify and screen people that either are at higher risk for cardiovascular disease or metabolic disease, where we want to make sure that they do have a healthy microbiome, or people who are taking probiotics. Did it make a difference? This is just a good area to think about. But I think it's like any supplements or things over the counter, you really have to look at the label and see what's really in there and how has it been tested. Is it GMP certified? Because again, FDA is not regulating these things. And then with medications like the omeprazole and other PPIs, long-term use, how's that impacting you? But there are other medications that are prescription strength that also cause those same issues that we're talking about with these over-the-counter proton pump inhibitors. So looking at that and talking to your provider about how these things interact with your metabolic system and with your microbiome, which determines a lot of the health of our metabolic system, I think that's all really important.
And isn't it interesting that we have this idea that the more sterile our environment, the healthier our microbiome and our bodies will be, but they've actually shown the opposite. There have been actual studies done. In homes that have dogs, they found that children are much healthier adults, and their immune systems are much healthier because they've been exposed to whatever the dog licked around the house. And it ends up on the kid.
It's going back to that old, let the kid eat a little dirt.
Yeah, it's true. And when you eat fresh, healthy, locally produced vegetables like we all love, there's dirt on that, and there's some good bacteria in the dirt.
Yeah.
And just that's why, when I was a kid growing up on my uncle's farm, we'd just wipe a carrot off on our shirt sleeve and then eat it. And, we turned out okay, as my
Yeah.
gram used to say. Well, this has been fun, understanding digestion and its role in the metabolic system.
Just eat dirt.
Just eat dirt. So, Dr. Cooper, quick takeaway for you on this episode?
I think it's just like thinking twice about these over-the-counter supplements and just thinking first, like, why am I having these symptoms? Try to get to the root of that. And then if you use some over-the-counter supplements, just scrutinize the labels and the packaging and the certifications, and then try to make them short-term if possible, because I think once you get on something really long-term, then if there are risks, those risks could start increasing.
Andrea, what about you? What's your takeaway?
I guess it's the age-old, don't just take stuff because everyone else is taking We're supposed to think, why am I taking this? What's wrong? And also the what's in it and that GMP thing is really important because you don't know. None of this is regulated. It's all like it's like a free for all right now. And you really do have to look because like billions, millions, who knows? You don't know. I mean, I'm not making it. I'm not in the lab. I don't know what the hell they're putting in that. It could be crushed up bugs. Who knows? Maybe crushed up bugs is good. We don't know. We don't know.
Yeah, maybe, depending on the bug.
Exactly. Could be filled with protein.
I guess my takeaway, and you've said this before, Dr. Cooper, food really is the best medicine that we
Good
can.
food.
Good food.
Yeah, it is.
The less processed foods that we eat, the better
Right.
it is for our bodies. And then if something does go wrong, then let's get a workup and see what's actually causing that.
Yeah.
So this has been really fun. Thanks for this discussion, you two, for another episode of Fat Science.
No diets, no agendas, just science that makes you feel better.
I'm Mark Wright. Thanks for listening to Fat Science with Dr. Emily Cooper. New episodes drop every Monday. If you've enjoyed the conversation, subscribe, rate, and review this podcast. This production is for informational purposes only and is not intended to replace professional medical advice. Join us next week for another episode dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better.